Why dog don't eat? Anorexia nervosa, and hyperexia, a decrease in appetite, in dogs can be distressing for pet parents and frequently signify an underlying medical ailment. Anorexia lasting longer than 24 hours should not be disregarded because it frequently signals the presence of another issue. Here are various explanations for why your dog isn't eating, along with a questionnaire that will help you identify the cause and some advice on what you can do to assist. Causes of dog's inability to eat. A dog may refuse to eat for a variety of reasons, but the medical, behavioral, problems with the actual food. Medical. Dog anorexia or hyperexia may have a wide range of medical factors, including anything that could induce discomfort, motion sickness, fatigue, or stress. Dental illness, toothache, nausea, vomiting, diarrhea, gastrointestinal parasites, pancreatitis, stomach upset, eating things they shouldn't have, eating table leftovers, or switching foods or rewards suddenly, infection, fever, cancer, liver illness, kidney illness, colitis of the bowels, enlarged heart disease, lung condition. There are numerous other potential causes besides these medical conditions that might cause dogs to lose their appetite. Behavioral. Like with people, some dogs may have decreased appetite due to anxiety, stress, or fear. Remember that your perception of stress may differ from your dog's perception of stress. Even seemingly insignificant events can cause your dog to become anxious and stop eating. Anxiety can be brought on by changes in the dog's habit or surroundings, such as new people or dogs in the home, traveling, or loud noises like construction, storms, or fireworks. Simple things like moving a meal's time or location might stress out particularly sensitive dogs, which may make them less willing to eat. A dog may also stay away from people due to intimidation from another pet living. Your dog, will he drink water? Your dog may be experiencing nausea, stress, or oral pain if she will drink water but not eat. It's encouraging if they can keep the water level down. However, if they start vomiting after consuming water, they should be seen by a veterinarian straight away because this could be a sign of severe motion sickness or a blockage in the digestive tract. Even if they are still drinking, they should be evaluated by their veterinarian to identify the underlying cause of their inappetence if they go more than 24 hours without eating. A veterinarian should be seen right away if your dog hasn't eaten or drunk in at least 24 hours in order to diagnose and treat any underlying conditions. Does your dog only consume treats? Your dog may be filling up on junk food instead of their own dog food if they will not eat dinner but will accept snacks or table scraps. However, a medical problem may be to blame for your dog's decreased appetite if they also exhibit other signs of illness. For instance, it can be that your dog is just receiving too many calories per day from treats and isn't hungry for their meal if they are content, active, drinking water, playing, and not experiencing any vomiting or diarrhea. They may also have outwitted you by foreseeing that they would receive delectable chicken and dog treats if they refuse to consume their food. However, your dog might not be feeling well if they are lethargic, experiencing any vomiting or diarrhea, starting to eat but stopping, drooling, or licking their lips. Even when they're not feeling well, many dogs are more likely to choose treats than their food since they offer bigger incentives. Consider a moment when you were sick but still managed to eat your favorite delicacy and skip the salad bar. If getting your dog to eat is becoming a regular struggle, it is always wise to be on the safe side and have any potential medical concerns cleared out. Does your dog refuse to eat dry food? Does your dog reject dry food yet gobble up canned food as soon as you put it down? This is a typical pet owner complaint that might imply a number of different things. Your dog can be experiencing tooth or mouth pain. Many pet owners mistakenly assume that if their animal companion is eating, they must not be experiencing mouth pain. Since they must eat, many dogs suffer in silence from oral pain for months or years before having any rotting or infected teeth out. Many dogs prefer canned food because it is simpler to chew than dry food, yet others may still consume dry food despite having severe oral pain. Your dog should visit your veterinarian for an oral examination if they notice that they no longer want to eat dry food but will accept canned food. Additionally, because canned food typically has a greater flavor and may be perceived as more of a prize, your dog may prefer it than dry food. To get your dog to eat more, try combining canned food with a dry kibble. Then, gradually increase the proportion of dry food until your dog is once again eating dry kibble. Some dogs flat out won't eat kibble and will only consume canned food. While feeding your dog canned food on a long-term basis may have some drawbacks, such as worsening dental problems or an increase in food costs, it may not be an issue. Ask your vet if feeding your dog a diet made entirely of canned foods could be the best choice for them.
Your dog, is it a puppy? A young, healthy puppy shouldn't fast for longer than a few hours. Puppies of small breeds, in particular, are more likely to have hypoglycemia, low blood sugar, and should be regularly monitored for signs of weakness or collapse if they are not being fed. They should need immediate care if this occurs. Some pups might not enjoy larger kibble since it might be challenging for their developing teeth to chew it, particularly if they are only starting to eat solid food. This can be fixed by adding water and allowing it to soak to make it more like porridge, or the kibble can also be combined with canned food. If your puppy still won't eat, you should take them to the vet straight away. They should be examined right away if they are also sluggish, throwing up, or experiencing diarrhea. Could separation anxiety affect your dog? When their pet parent isn't home, many dogs with separation anxiety won't eat. Some dogs who suffer from separation anxiety even anticipate having their human companion in the room while they eat and stop when their person leaves. Although this isn't usually a symptom of a health issue, it could indicate that your dog has a serious anxiety issue that needs to be treated. The use of soothing pheromone collars or diffusers, such as Adaptil, as well as relaxing chews like Composure or Solican, may be therapeutic. However, you should think about seeking assistance from a board-certified veterinary behaviorist if you are worried that your dog may have significant separation anxiety. Did you change your dog's food? Your dog might not feel like eating if you switch their food too rapidly because it may upset their tummy. To prevent stomach distress, it's crucial to switch foods gradually over a period of 7 to 10 days. This also enables your dog to gradually adjust to the new diet rather than switching all at once. Does your dog have diabetes? If your diabetic dog refuses to eat, it may be a sign that there is a major problem. If your dog isn't eating when your dog is diagnosed, ask your veterinarian what they advise doing. Dogs shouldn't often be administered insulin if they aren't eating, because doing so can result in dangerously low hypoglycemia. If your dog misses one meal, follow your veterinarian's advice and administer a half dose of insulin. However, if your dog misses another meal. How to handle an unwilling dog to eat. Visit your veterinarian right away if your dog isn't eating and is also sluggish, vomiting, or has diarrhea. Here are some strategies you can use to get your dog to eat if you don't notice any of these. The dog chow will soften if you add water or low-sodium chicken broth and let it soak for a while. Microwave canned food for a brief period of time to reheat. Make sure to take it out of the metal can and put it into a microwave-safe bowl. Call your veterinarian right away. The symptoms of hypoglycemia or diabetic ketoacidosis, both of which are life-threatening if left untreated, include lethargy, non-responsiveness, vomiting, and diarrhea in diabetic dogs. If your diabetic dog exhibits any of these symptoms, they should be examined by a veterinarian straight once. How to handle an unwilling dog to eat. Visit your veterinarian right away if your dog isn't eating and is also sluggish, vomiting, or has diarrhea. Here are some strategies you can use to get your dog to eat if you don't notice any of these. The dog chow will soften if you add water or low-sodium chicken broth and let it soak for a while. Microwave canned food for a brief period of time to reheat. Make sure to take it out of the metal can and put it into a microwave-safe bowl. To avoid tongue burns, feel the food before eating it since canned food can get scalding hot very rapidly. To get them to eat, try mixing some plain, skinless, boneless, boiled chicken and rice with their kibble. Top the food with a probiotic supplement like Purina Fortiflora or Advita. By re-establishing a healthy gut flora, this can not only improve the food's palatability, but also speed the healing of any injured or irritated intestines. After using these methods, If your dog still won't eat, you should take him to the vet to rule out any underlying medical issues. Imodium and Pepto-Bismol are two over-the-counter digestive aids that should not be given to your dog unless specifically prescribed by your veterinarian, since they may have negative side effects or even conflict with other medications your veterinarian may want to administer. Before attempting to treat symptoms at home, it is recommended to speak with your veterinarian. I hope this explanation helps, and I thank you for listening.